disproportionately impacted by COVID-19. Along with better access to testing, we are acutely aware of the need to do better, more robust, and routinely collected disaggregated data. As my colleague, Minister Bennett, says, you can't mend what you don't measure. And to be frank, the data that my department provides is limited by what it's being collected. This means accurate data is only available for First Nations living on reserve and for Inuit living in Inuit Nunangat. I ask people to remember the number that I gave at the outset. And if you look at the numbers in the far north in La Loche, the number of positive cases is at about 170 plus. Of that, there are 16 on-reserve Indigenous positive cases. But given that La Loche is a Métis Dene community of an overwhelming majority, the presumption then is that the entire 179 cases or so are Indigenous. And that's a gap in the data, frankly. When Indigenous leaders, and I would add, I would pause to say, when you put that in an urban context such as Montreal or Toronto or Vancouver or Calgary or Winnipeg, that data is just not there. When Indigenous leaders and organizations are calling for better data to be collected and disseminated to them, we need to make sure they have that data. It needs to include data for Inuit outside Inuit Nunangat, among citizens of the Métis Nation or First Nations people living off their reserves, and for this to be realized, we need help from provincial governments and public health agencies. This type of information is critical not only for Indigenous communities, but for many vulnerable groups. We need to be able to put forward tailored measures to prevent any further outbreaks, as well as to expand and improve effective interventions if they occur. Indigenous-led analysis of this information is necessary to advancing culturally appropriate and science-based approaches, both with on and off reserve for First Nations and with Inuit and Métis communities. Indigenous Services Canada is playing a key role in collaboration with First Nations, Inuit and Métis partners, the Public Health Agency of Canada and the provinces and territories to support ongoing surveillance of COVID-19 positive cases for on-reserve communities. However, this data, as I mentioned, is not enough to provide us with an accurate overview of the impact of the virus in First Nations living off reserve, as well as in Inuit and Métis communities. This is why I'm pleased today to speak to the work of Dr. Janet Smiley, a Métis research scientist and physician at the Centre of Urban Health Solutions at St. Michael's Hospital in Toronto. She's currently working, along with many other partners, to collect the necessary data that will allow for better understanding and modeling of COVID-19 cases in Indigenous populations in Canada. As part of the efforts and our efforts to support better distinctions-based data collection, we're providing $250,000 to this critical initiative to implement a COVID-19 tracking and response platforms for First Nations, Inuit, and Métis. This project will include the development of a COVID-19 consortium comprised of federal, provincial, territorial, First Nations, Inuit, and Métis partners, and their data analysis will help inform the response to COVID-19 by Indigenous communities with the support from the federal government. In the short term, we hope that our work will help mitigate the adverse and disproportionate impacts of COVID-19 on First Nations, Inuit, and Métis. They are leading the way in addressing this data gap, and I applaud them in this work and effort and look forward to the additional initiatives in this space. As I've highlighted before, on another topic, remote and fly-in First Nations communities are vulnerable during this time. The ongoing delivery of essential services, medical care, foremost, and supplies to these communities in a time when travel is limited is particularly challenging, but critical to Canada's overall response to COVID-19. To minimize the risk and the exposure of the virus to community members and service providers alike, we are transporting essential service personnel and supplies via carefully managed flights that adhere to strict health safety measures on airlines that already serve these communities. The first flights of this nature took place on April 22nd. That day, 45 nursing professionals were flown to and from 23 First Nations communities in flying communities in Manitoba and Ontario. On April 27th, another 22 nursing professionals were flown to 13 First Nations communities, and 18 left the communities on their return charter flights. These charters ensure that healthcare and infrastructure professionals, medical supplies and equipment required to maintain critical infrastructure such as water treatment plants will be able to access these communities. It also provides flexibility to support other community needs such as emergency management responses, food security, or medevac services. In addition to maintaining critical services, this approach also provides a much-needed revenue stream to airlines serving Indigenous communities, helping to support their economic long-term and short-term viability. As we face unprecedented times, nurses working in Indigenous communities continue to demonstrate their selfless dedication to ensure the highest quality of culturally appropriate care, testing, and treatment. Once again, I want to thank the First Nations, Inuit, and Métis nurses practicing in various settings in Canada, caring for patients while working to promote and provide culturally safe healthcare.
Although the numbers across Canada remain positive overall, I reiterate that we must all follow the public health directives and advice, such as maintaining physical distance, washing our hands, and avoiding large gatherings. These efforts continue to be crucial to slow the spread of COVID-19 within communities and between individuals. Our goal is to continue to work in partnership with First Nations, Inuit, and Métis, and as provinces, territories, and cities begin to discuss easing restrictions, we will continue to be extremely vigilant and defend the unique perspective and position in which Inuit, First Nations, and Métis communities find themselves. I remain encouraged by measures taken by Indigenous leaders across the country, and I'm asking everyone to remain vigilant while we all work together so that everyone can be healthy and safe. Thank you.
Maintenant, on est impatient de prendre des questions.
We will begin with questions now.
We'll start on the phone with 3 questions. 1 question, 1 follow-up, et on va venir dans la salle par la suite. Operator.
Thank you. The first question is from Michel Lamarche from TVA Nouvelle. La première question de Michel Lamarche de TVA Nouvelle.
Question from TVA Nouvelle. Go ahead.
Oui, bonjour, peut-être.
Hello.
Une première question
A first question for Dr. Tam, perhaps, and Dr. New. I'd like to hear your comments on the situation that is persisting in long-term care homes. This morning, you talked about a national tragedy. No less. Are you perplexed by the fact that it remains so problematic in many of these long-term care homes? In which where authorities do not seem to have taken control of the situation whatsoever? Answer. Thank you for the question. This is Dr. New. It certainly is a national tragedy across the whole country, since we're seeing in all provinces and territories that there are outbreaks currently in long-term care homes. It's also a problem in Quebec. We know that there are challenges, even structural challenges. Sometimes in institutions there are 2, 3, 4 people per room, and it's difficult to confine people who are ill and separate them from others who are not necessarily infected with the virus. But we know that health authorities on the ground are doing everything they can to test, identify, isolate, and treat people, perhaps sending patients to hospitals as required. I think this is a lesson for everyone to learn at all levels of government. And following this pandemic, perhaps we should have an inquiry to look at how we're treating our seniors, how we're supporting them. And in other language, I'm not sure how to say it, but how we can do better in supporting these residences and long-term care homes. And as Dr. Tam and I have said, even for the staff too, because it's not just about residences, but all of these workers who are doing good work and doing their best under very difficult conditions. So we haven't found all the solutions and answers now yet, but we're looking at what's going on now, and as we move through the situation, we are providing our best efforts. And I think maybe we are beginning to see the light at the end of the tunnel. Thank you.
What's happening in sort of long-term care establishments across the country, as Dr. Tam and I've said, really is a national tragedy. Many of the issues or challenges in long-term care facilities, I think, are evident. There's even structural ones in terms of, sometimes there are 2, 3, 4 individuals in a room. It's difficult to separate a cohort, sick people from the well people. There's also challenges, as we all appreciate, in terms of the personnel who are doing their best, obviously working in these facilities that obviously, as we know, may not have the supports they need, as we talked about, the pay, the fact they sometimes have to work between several facilities. So there's lots that we need to learn from what's happening. Certainly, I think after all this is done, I think even as our minister has said, that there needs to be, I think, a national conversation about how we treat our elders, how we house them, take care of them in their later years. So that's something that needs to be done. But certainly at the present time, everyone's doing their best, and I think we are starting to see a bit of, I guess, a light at the end of the tunnel. I would just say, as our minister said, I think we need a national conversation. What the form is not for me to say. I think it's a conversation at different levels of government. I think also different sectors. I think it's a conversation beyond public health. I'm sticking to, as they say, the public health aspects. We certainly show from the epidemiology that older individuals, obviously those in long-term care facilities, are at a particular risk in terms of having, as they say, more severe consequences, obviously including death, if they do become infected with this virus. But then how that translates in terms of the conversations that many other sectors and levels of government need to have to help manage and hopefully prevent and not have this type of situation occur should there be another second wave or even a future pandemic of another virus. Yes, that needs to happen. Thank you.
Michel, en suivi.
Follow-up question? Perhaps a second question for Minister Miller. Minister, I'd like to hear, as a Montreal MP, do you share the Prime Minister's concerns, which is what he said this morning, looking at the outbreaks in all of these communities in Montreal? And as Montreal considers reopening, should we be risking the health and safety of the most vulnerable populations? Why not slow down the opening in the greater Montreal region?
Merci, Michel.
Answer. Thank you, Michel. Yes, absolutely. I am an MP for downtown Montreal. In which, of course, there are long-term health care homes, and the Army's been deployed. We have made superhuman efforts, huge efforts, and asked Montrealers to make huge efforts as well to stay at home. So if we started loosening restrictions too soon, it could endanger certain populations. My parents are in Montreal, in fact. My father will be 80 this year. He's a very vulnerable person. And my mother is 76. So this is, of course, personal, but it's also scientific. We can see what's going on in seniors' residences. These are the most vulnerable populations, and they're there because they're vulnerable in the first place, and they want to live out the rest of their lives in dignity, and they're dying without dignity. We certainly have some long-term thinking to do after this pandemic is over. We are certainly not out of the woods yet. It's going to require a bit more effort from Canadians to ensure that we're not struck with a second and third wave. Those are my comments.
Look, I'm an MP from downtown Montreal, and that is where, along with a number of other MPs that are in our caucus and cabinet, the pandemic is hitting, and it is at its worst. The people that are dying are, the vast majority, as Dr. Tam said, very old. They have spent and been put into long-term care facilities to spend the rest of their days in dignity, and they're dying in indignity in vast numbers. And that will continue if there are measures that are relaxed too soon. That is the scientific conclusion. The Army is working as best it can. People that are willing to put their lives at risk. That's why they join the armed forces, and they're doing something that they are not used to doing, and they are doing it with exceptional professionalism. And we need to let them do their work. We need to let the virus run its course with all the measures that we've put in place, and we've asked Canadians to do that they're not used to doing. And so to measures in a premature fashion would just raise another question about another wave or a third come hit us harder than it should if we were to continue along the lines and according to all the sacrifices we've asked people to make and all the hit that it's had on the economy. So the issue is really to come out stronger and strong, and not worrying about a second wave or additional shutdown measures. And we're asking people to do and to be a little more patient. We're not out of the woods. And if you ask any of our top scientific minds, I think they would agree.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question de Teresa Wright de la Canadian Press. The next question from Teresa Wright from the Canadian Press. Please go ahead.
Yes, good morning. I have a question about masks. I'll pose it to Dr. Tam, but perhaps Minister Miller, you could also weigh in as it has to do with procurement. Earlier this week, the Chinese embassy said the 1 million N95 masks that were rejected by Canada last month were the result of a contractual issue. We still haven't been given a clear answer about what happened there. Now there are 8 million more masks that have been rejected. Can you give a clear answer about why Canada is rejecting these masks and whether we're still planning to purchase further supplies from these companies?
It's Teresa Tam here. I'll just start from the perspective of the agency. We conduct the testing, basically. So that's where we found that a significant proportion of these masks did not meet our standards. So, and just to say that none of them have been distributed for medical use. So that is sort of our key responsibility. And I know that the teams that are working on the contracts, of course, and the supplies are looking at this very carefully. I don't personally know what the contractual issue is that someone has cited, but I think our job is to make sure that whatever goes out, it meets a certain standard. And of course, when this much product does not meet standard, you have to go back and look at that arrangement.
Well, I think that's right, Teresa. I think what you've seen publicly is concerns over a number of issues that among other, Mr. Anand has mentioned, which is, in one case, whether the straps were adequate. There's perhaps concerns over the quality of the filtration, whether these masks can be repurposed. When you're working in real time trying to prevent the onset of a pandemic, you make decisions. You make decisions quickly, and the real challenge is to adjust in real time when you recognize that you may not have a source quality that works. and to move on. But as Dr. Tam said, we test vigorously. I think that's something people should be glad for, frankly, as opposed to just deploying them into the public health system and encountering a lot of other headaches. So recognizing that, it's very possible. And I'm not part of these discussions. I would direct those questions, frankly, to Minister Anand. So I don't know the contractual terms in between the parties, and I can't speak to that. But recognizing that what Dr. Tam said is that we are testing and we are not deploying things that we believe are unsafe for the purposes that they were purchased for, and that's an important conclusion.
Teresa, follow-up?
Yes, thank you. Just on some of the comments that you mentioned in your opening remarks, Minister Miller, about a gap in data that's not allowing us to get a full picture of how COVID-19 is affecting Indigenous populations. As you said in your remarks, a lot of this is because the data is held by provinces and territories. What measures can the federal government take to try to perhaps compel provinces and territories to provide this data? And how confident are you that they actually have the data or capturing this data as the pandemic has been spreading?
Well, that's two separate and very important considerations, Teresa. First, if the provinces and territories have the data, that's the easy part. And it's a question of really coordinating. And because we are moving at the rate that we are moving, it's a question of gathering that and collating it and comparing it. And having our top scientific minds work on it and draw conclusions for really two purposes. The first purpose is, as everyone knows, we've put forward some very rough approaches to trying to contain the pandemic, asking people to isolate, clamping down, asking people to quarantine, and that data is important across sectors and not just with respect to Indigenous populations, but race-based data, ethnocultural data that's being collected, and it allows you in the short term to be able to take measures that are more targeted, whether you surround old age homes, if you have age-based data, if you have certain communities that are vulnerable for whatever reasons, you can target your response as you try to address a pandemic before you get the vaccine. And the second measure, and it is an equally important measure in the long term, is you can't do good public health policy without the data to underpin it. And in order to do that, you need to have accurate data at the source. You can tease this together, and a lot of scientific modeling has a lot of projections and assumptions in it, but it is always based on a core set of assumptions based on data collection. And so what we have is across the jurisdictions, all the provinces and the territories, that when they test someone have a different sheet with a different set of pieces of information. Now, assuming that those sheets have disaggregated data identifiers to begin with, we need people on the ground filling them out and then collecting them as they try to prevent people from getting infected. So it's a lot on frontline workers to ask them to do, but the importance that I'm trying to get out and we're trying to get out as a team is we need that data to be able to accurate information with respect to communities, get it out so that people know what the measures can be taken to address COVID-19 and how it's profiling, and then give accurate models. The other consideration, which is a very important consideration with respect to Indigenous communities, is Indigenous control over Indigenous data. Layered onto that is a sub-concern dealing with private patient confidentiality that we have to respect. The worst thing that could happen is to create another set of stigmas that would fly around, and people would judge people for no particular reason. But that data is important to collect, and we do have to be sensitive to First Nations control over First Nations data. But the premise to that is that we have to be collecting it in the first place. And while Indigenous Services Canada, for its part, is able to tease out the amount of people that are testing positive in communities on reserve or in the far north. When it comes to particular population, which half the Indigenous population of Canada is off reserve, quote unquote, mostly in the main urban centres. And that really is the responsibility of the testing protocols of the province. And that data is either not collected or imperfect in its collection basis. And that's why we've teamed up with the folks at the University of Toronto at St. Michael's to make sure that we have a center focal point with people that know what they're doing so that we can get a better sense of modeling. But I will hide from no one the fact that on the ground, the testing and the collection of that data right now is far from perfect.
Thank you, Minister. Operator, next question, please.
The next question. The next question is from Althea Raj from Huffington Post. La prochaine question d'Althea Raj, Huffington Post.
Hello? I'm hoping you can hear me. Yeah, okay, great. My question is for Dr. Tam and Dr. New. I guess I'm going to try this again from yesterday. You said that we need to test more. Yesterday you said that you're not hearing anything specific about the provinces and the territories not having enough swabs or reagents. So what do we need to do to increase testing?
So I think, as I said yesterday, there's a capacity, but we, as a public health community, the chief medical officers feel that you have to test for the right reasons at the right place. So just upping the numbers isn't necessarily the approach. But all of them, let's just say, are expanding their testing to include people with a whole range of symptoms. That's one way of trying to widen your net to see if there's any further cases in the community, for example. You will see that many jurisdictions are now doing quite a lot of they're essentially being very low threshold in testing high-risk settings. So if it's a long-term care facility, if it's a correctional facility, if you've got an inkling that anyone is sick, test them, but also if there's a case, to rapidly enhance testing under all of those high-risk conditions is a good strategy. The other thing is that it depends on the epidemiology. And so epidemiology is changing in Canada, and those numbers will go up and down as a result. Yesterday, you may have seen that in Quebec, in the area most affected, they are increasing the testing by mobilizing clinics to go into the hotspots. And that is how they are increasing their numbers. And also, Ontario, for example, is doing a systematic testing of their long-term care facilities. So those are sort of in alignment with where these outbreaks and cases are occurring, but also to widen the net in the community setting. There's also been sort of surveillance approaches, and we will be examining more of these strategies as we move into the next phase with the Chief Medical Officer of Health, but also our public health laboratory networks. So the guidance, for example, in the next phase is under discussion at the Special Advisory Committee as to where else would you need to test more. But you can't just sort of indiscriminately test areas where there are no cases and for which people have no symptoms. So otherwise you, again, get into these issues of test interpretation. But it is an area that we're very seized with and how we do expand into that. The other concept is surge capacity, because there may be other waves, and they may be waves into the future. We all got to sort of prepare for it by upping the capacity itself. If you expend a lot of tests, reagents, swabs, whatever, now in areas where there's probably not needed, you're then diminishing that capacity for when you actually need it. So this is a complex discussion where we all agree that even with 60,000, that's a good capacity, but we're not stopping increasing our supplies, resources, etc., to even beyond that, because you got to sort of prepare for resurgences, etc. But each jurisdiction may have their own reasons as to why they haven't. They've all set different targets, and their abilities and their reasons for not yet reaching those targets, for example, is diverse, I would say.
It's Dr. Maybe I can just expand a little bit on what Dr. Tam has been saying. I think it's important to clarify, when we've been talking about this sort of 60,000 tests, that speaks to, I think, from what I understand, the laboratory capacity. So the ability of, quote, the laboratories across the country to actually, quote, process the samples. But as we all know, there's, of course, a lot of steps in between in terms of actually, quote, getting the samples from the patients who need to be tested and then getting to the laboratory so then they can do the analysis. So what we're seeing sometimes, for example, the case in the city of Montreal is that it's not just a question of having the laboratory capacity to analyze, centralized, but it's also having, quote, accessibility for the people who need to be tested to then, quote, get the samples taken as appropriate to then be sent to the laboratory. So in that regard, I certainly we're seeing, for example, in the city of Montreal, good steps in terms of increasing accessibility with sort of mobile sites, et cetera, so that the patients, it's actually closer and easier for the people who need to be tested to get tested. So that's one of the things that we're seeing on the ground that obviously is getting better and better. Thank you.
I'll see you a follow-up.
Okay. We're getting, closer to the answer I was looking for yesterday. But so I appreciate that you're explaining to us what we need to do to expand capacity in terms of like who we should be testing. But when you talk about accessibility, can you outline those reasons? Dr. Tam, you said there are many reasons. Like, practically speaking, how could the provinces be testing more? What needs to be done to increase testing practically?
So I think that depends on the jurisdiction themselves. So a lot of the provinces that have had no cases, they've had no transmission, they're in a very different situation than some of the larger provinces who do have cases and are still dealing with some community transmission. So it depends on where you're talking about. It does have to be tailored to the individual setting. Some areas might actually have human resource issues. You need actual people to go out to test cases. So making sure you have the necessary trained people who can do the testing is one. Dr. News talked about accessibility, maybe making those testing clinics closer to where people are. We talked about the deployment of certain more closer to patient tests, like point-of-care testing, to the more remote communities. That's another area where we can, increase capacity as well, so that people don't have that sort of turnaround time. In Saskatchewan, for example, that was a good sort of example of how they are now systematically looking at those communities where there have been cases in the north. And that involved the deployment, which they have now access to, some of the sort of point-of-care testing capacity. And so there are a number of these, I guess, challenges that each jurisdiction has to undergo, from, as Dr. Neal, the moment that the patient needs to be tested all the way down to transportation and, laboratory testing capabilities. And a lot of the strategies are designed to tackle each one of these components. But it might quite well be different in downtown Montreal to downtown Toronto to Saskatchewan.
Thank you, Doctor. We'll now turn to the room, starting with Christian Noël de Radio-Canada.
Bonjour.
Question from Radio Canada.
Miller et
I have a question for Mr. Miller and for Dr. Tam as well. Mr. Miller, you said about Montreal, we're not out of the woods. Perhaps we're going too quickly. Could you specify what your concerns are for people and also what it means for the future if we're moving too quickly? And for Drs. New and Dr. Tam, do you share that concern? And that of the Quebec National Institution of Public Health is saying that, which stated that if we opened up too quickly and eased restrictions too quickly, it would lead to further deaths and illness. Answer. Firstly, I'm afraid of more people dying, and secondly, I'm afraid of further outbreaks.
Merci, Dr. New.
Follow-up answer? Yes, this is Dr. New. Thank you. We are continuing our discussions. We're in good communications with our Quebec counterparts. And certainly in Montreal, the situation is more serious than the rest of Quebec. It's quite complex, in fact. Currently, we have a very difficult situation in long-term care homes, but it's also related to what's going on in the Montreal hospitals, because before, perhaps when seniors were quite ill, they were transferred for compassionate care in hospitals. But what's now going on in institutions with the outbreaks is that it's not a good idea to transfer them transfer them back to the long-term care homes. So they are sent to hospital. They're in beds with not much flexibility and not much wiggle room in the hospital's capacity, especially if we're expecting a second and third wave, potentially. So we need to closely look at the Montreal system and situation and do a lot of testing and tracing, because if we start lifting public health restrictions, we have to be ready to adjust as we go along, as the situation evolves. I'm not there on the ground, but I can see what the other Quebec public health authorities are doing. So maybe there's a schedule for all of Quebec, but it may be a bit different for Montreal, for stores and shops, for example, because the situation is different in Montreal compared to the rest of the province.
In English, where was I? Yeah, the situation in Montreal, it's obviously, everyone recognizes it's serious, and it is complex, for example, because of the situation that we know is a problem in the long-term care facilities. Perhaps several weeks ago, obviously there were patients there, residents who were sick, ill, and then were transferred to hospitals in Montreal. But now, with this sort of the ongoing situation in those facilities, it's not appropriate to be, quote, transferring these patients back, and therefore, obviously, they're taking up beds in the hospitals. In the hospitals in Montreal, there's not largely say excess capacity or sorry, call it, surge capacity in case there might be a second wave or sort of another uptick in cases. So that's why the authorities in Montreal are watching the situation carefully. It's for sure important that you need to have a very good surveillance system, testing system. So as the measures of this, sort of a slight relaxation of the public health measures are taking place, and maybe there might be opening of schools or businesses, that you have to be ready to be able to detect rapidly, deal with the situation, and then maybe adjust as it goes along.
And this one is for Dr. Tam and maybe Dr. New as well, but Dr. Tam, I'd like to hear you first on this. If Quebec is one of the hardest hit area, Montreal as well, and they seem to be proceeding maybe early, maybe quicker than other area, cases seems to be still increasing, testing is not up to par. Do you feel Montreal and Quebec is following the federal guidelines right now for deconfining, and what would you suggest they do?
Well, I think from all the chief medical officers, we laid down the sort of criteria for relaxing, if you like, the public health measures, which includes the testing, the ability to do case and contact tracing, isolation, quarantine, etc., and making sure there's capacity. So all this is being evaluated by the jurisdiction every day. They may or may not change the target date according to the situation, and I think that's what they're trying to do every day. And so there has to be flexibility, and that, I think that is very clear to our colleagues that the Montreal area is different to other areas of Quebec. And they're being cautious, so some of these measures are done outside of that area. They've moved these mobile clinics into certain hotspots to get some more testing. So they are going to try to be very, very careful about this, and they have to evaluate this probably on a daily basis in terms of what's going to happen.
Pardon? Non, on n'a pas dit ça, c'est Dr. New. Je pense que
this is Dr. New. No, we didn't say that. I think that the Quebec health authorities, and not just of Quebec, but in Montreal too, are analyzing the situation as we go through it. And there's also a special advisory committee which is looking at all measures, even preventive measures at the individual level, washing one's hands often, maintaining social distancing, physical distancing of 2 meters minimum. These are all important measures and remain so. I think in Montreal and public transportation, we have strongly recommended that people wear non-medical masks if they are going to use public transportation. So I see that, and the Montreal health authorities have done that. They are taking our recommendations seriously while adapting them to their own context in Montreal. Thank you.
Good afternoon, Ashley Burke, CBC News. Dr. New talked about having a national conversation around long-term care after this is all said and done because it is a national tragedy. Minister Miller and Dr. Tam, do you think that's a good idea? Should there be a public inquiry into long-term care homes after this?
Look, Ashley, I think as I'd mentioned earlier, what we're seeing is that really the older segments of the population, those in long-term care facilities, are being, by a vast proportion, heavily impacted by this. It's a question, as a human being, I think everyone is asking ourselves how we treat, in some cases, our grandparents and our elder segments of the population. What form that takes. Without any question, I think everyone's going to be asking themselves that. I think there needs to be some serious look into the way that is done on an institutional basis. It's probably premature to speculate as to what form that lesson takes. I think that is probably the smaller consideration to the bigger reflection we all need to have as to how we finance, resource, help those people that are the most vulnerable. In this case, perhaps the greatest generation that are the reason why we live in a free and democratic country. It is scary to see people fall like that. And when you talk about Indigenous communities in particular, you're seeing some people that are last carriers of their language, and you could see entire languages disappear. So those are particular vulnerabilities that I see in my files. I think Tom sees them as well, and that risk is top of mind when we look at Indigenous communities. When we look at Canada writ large, we need to be asking ourselves those serious questions, and there needs to be serious discussions around financing, around funds, around support, around even how we ourselves treat some our own grandparents. Some of the stories coming out of those long-term care facilities, you see people that are looking for refugee status that are helping out. You see first-generation Canadians. You see people that are working for low-paying jobs. That's another reflection I think we all need to have. But that needs to be institutionalized in a form, and I think that is secondary to the greater consideration, which is how we treat our elders. Dr. Tam, if you want to add.
Yeah, and again, I'm not going to speculate the format at which that takes place, but it is really critical that, out of all the impacts of this pandemic, we've got to learn something in a huge way about how we treat, as individuals, society, communities, governments, on our older adults, and in particular, those who reside in long-term care homes and assisted living. But there may be other areas where seniors reside as well that needs to be improved. So I think it's a big, vital conversation. It's probably not a single one. It's going to be many different ones coming together because so many people are involved. So absolutely, we've got to do better as a nation.
Yeah, and Dr. Hughes, to be clear for the record, I'm not personally asking, I used to say, for a public inquiry. I basically reflected what our Health Minister, Minister Haidu, has said previously about the need after this is all over to have, quote, a national conversation. So exactly as Minister Miller and Dr. Tam have said, the nature and form determined, but I think we can all agree in terms of we need to take care of what needs to be done now. And then afterwards, I think upon reflection, there's different ways we can have that type of conversation in different ways and do better. Thank you. Okay.
Answer repeated in French. As I said, I think that's what's currently happening with our seniors is a tragedy in our long-term care homes. As Haidu already said, we're going to have a national conversation across the country at all levels of government and across all sectors to see how we can do better.
And just about masks, Dr. Tam, I'm hoping to find out what you're hearing from your from medical officers of health across the country about the supply of N95 masks, especially at long-term care homes. Shipment, this most recent one of 8 million masks that was rejected because they weren't up to that quality. What impact might have that had, and on particular in long-term care homes?
I actually don't have the details on specific impacts on long-term care homes. We do have, daily linkages with all provinces and territories as to what the requirements are. And I do know that there's a sort of distribution framework that is at play, but I'm sure that any shipment that has to be rejected will have some pressure on the health system in terms of its N95 capacity. But I do know that all the requests for assistance that we've received, I think over 40, the majority of them have either been met or are in the process of being met. I don't know the exact numbers.